From Nevada Public Radio, I'm Joe Shaneman. It's State of Nevada. If you've been outside, this is the perfect time of year. It's breezy, it's not too hot, it's not too cold. You like it, and so do your pets, but there are a lot of things to think about when it comes to your dog, cat, or other pets to keep them safe this time of year, especially when they're outside. There's a fluke worm in the Colorado River that scientists say they're seeing here for the first time, and it can be very dangerous for dogs. There's a canine flu going around that spreads very quickly. And of course, Easter is around the corner. What better gift to give your kid than a rabbit, right? Or right? We have two people with us immersed in animal care and concerns. Dr. Shadi Ireifej is a veterinarian, a chief medical officer of his business, VetTriage.com. And Nikki Martinez is the Feline Solutions Director for Hearts Alive Village, a nonprofit no-kill animal rescue in Las Vegas. Shadi and Nikki, welcome to State of Nevada.
Yeah, thank you for having us.
Thank you for having us.
And Nikki, I'm going to start with you because there's been a lot happening in the world of animal rescue and shelters, and Hearts Alive Village has been around for more than a decade. It's really an integral part of the animal rescue here in Clark County. A lot of people are familiar with the Animal Foundation, the public shelter. How is your rescue different?
So we're a nonprofit, as you mentioned. We also do not rely on government funding. It's not a municipal shelter. We're a private rescue that relies on private donations and grants as well. I obviously work in the feline department, and last year we took in 1,257 cats.
Holy cow!
For our rescue.
Is there a limit?
Yeah, it's limited on space availability. It's limited, if we have enough fosters. A lot of our program animals come in and go directly into foster homes. And of course, it's limited on funding, so we do rely on public funds.
Yeah. How much, give us an estimate, how much do you need to raise in a year to keep going at the level you're at now?
We're talking a lot. It's an estimated over $170,000 a month.
Wow.
Yeah, to run our rescue. So we do rely on those grants and public donations.
The last time we did a show, a pet show, we talked about cats and the popularity of cats, and the people we had on said they basically ran out. Like, people were adopting them so frequently, they didn't have any cats to adopt out. Are you seeing the same kind of thing?
At times. So kitten season is a thing. People don't realize that. Kitten season starts for us in mid to late spring and runs all the way through summer. We have a warmer temperature climate around here in Vegas, so most of the year is kitten season for us. But for the colder months, winter months, we don't see as many kittens in the rescue environment, and so we highlight our adult cats available for adoption, and they get adopted quicker. And at times we do have a need for adult cats intake, but we average about a call an hour to take in cats and kittens. So we are busy.
Does it surprise you then when you hear about some of the, like the Animal Foundation and the thousands of animals that they euthanize when
Right.
there are times when you can't keep enough cats around for people to adopt?
Yeah, and we're talking about adoptable cats, so cats that are friendly and social with people. So those are the cats that our rescue highlights available for adoption. Not all cats are friendly and social that come into a shelter environment, and they're limited on space and resources as well.
Do you also have a foster program for animals?
Absolutely. We rely on our foster program heavily. The majority of the kittens that enter our rescue go directly into foster homes. And we're entering into kitten season. We're seeing newborn motherless kittens that are entering into our rescue. And we have a great need for foster homes, especially those who are willing to bottle feed or take care of mothers and kittens.
Are there requirements by somebody who wants to foster a kitten or a cat?
So no previous experience is needed. They would just need to reach out to us on our rescue website, which is heartsalivevillage.org. They can complete a foster application there, and no previous experience needed. We will provide them with the basic supplies as well as support to care for that animal.
This is Nikki Martinez. She is the Feline Solutions Director for Hearts Alive Village, which is a nonprofit no-kill rescue here in Las Vegas. We're talking about your pets. Our pets really aren't pets that much anymore to people. They're really more like family. And we all want to take care of them the best that we can, keep them safe, keep them happy. And we also have a veterinarian with us, Shadi Ireifej of VetTriage.com. And I have this email from Rob in Summerlin. And he says, my dog is starting to get older, and I've noticed he's started to have a hard time seeing. Is there anything I can do to help him? Shadi.
So age-related deterioration in dogs, just like in people, is very common. You do want to make sure that there's not actual ocular pathology affecting your dog. So for example, dogs with diabetes are prone to getting cataract formation, which will cause blindness. So we need to make sure they don't have actual eye disease. The second rule out is going to be anything related to the nervous system. So brain disease, for example, if you have a larger dog like a golden retriever, they are prone to things like brain tumors, which are more common in older pets. If you go at the medical route and you rule out all of these possibilities for poor vision or blindness, then you're left with its age-related change. And from there, I recommend things like don't change your home environment that often because your dog will memorize where they live so they don't knock into things. Make sure food and water is at the same location every single time so that they know where to find the food and water. It's all about environmental modification. As far as ocular health, I don't know of anything off the top of my head, although I do always recommend fish oil supplementation. Fish oil helps with the maintenance of joints, skin, GI tract. And so ocular health may be in that category as well, I'm not sure. But beyond that, it's more of environmental modification, keeping that to a minimum, making sure that your pet knows how to get around, avoiding stairs so they don't fall down, things like that.
Do dogs get cataracts?
They do get cataracts.
Do people
yes.
get cataract surgery for them?
Yes, absolutely. So cataract surgery is usually performed, well, actually almost always performed by a board-certified veterinary ophthalmologist. And you want to make sure the actual eye beneath the cataract can still see. Otherwise, why perform the procedure? Mm-hmm. So usually the ophthalmologists are going to conduct other tests to make sure the eye can see once the cataract is removed. If not, then cataract surgery is probably not in your best interest, although sometimes you can have secondary disease from cataracts, especially as they get dissolved in the eye. But cataracts can be either breed-related, like genetics, or it can be from disease, like I mentioned with diabetes mellitus.
Wow. I'm also here with Nikki Martinez, Feline Solutions Director for Hearts Alive Village. Give us a call if you have questions or comments. You can also email son@knpr.org. And I have an email here from Christina who says, my question is, with the appearance of mosquitoes in Las Vegas, should we be worried about heartworm disease, and how should we be treating our pets?
So classically, we've only pushed heartworm prevention in areas of the United States where mosquitoes are a big deal. So mosquitoes transmit this parasitic worm. It's called heartworm disease, which can cause multiple issues in your dog, specifically cardiac issues and cardiac failure. So heartworm prevention is usually pushed in areas of the U.S., like down south, where mosquitoes are very prevalent. However, this trend of where we're seeing more mosquitoes, ticks, fleas in these typically arid environments
You're hearing about this more here.
Yes, yeah, correct. Yeah, as weather gets wetter, these parasitic diseases become more prevalent. And it changes slowly over time, but when you look at the prevalence of these conditions, it's increasing. So heartworm prevention is a great idea, especially if you live in an area where you're starting to see mosquitoes.
That is fascinating. And by the way, Nikki, I want to go back to you before we get to some more of these calls and emails. You actually have a horse ranch. You have pet food and supplies for people in need that it can be free. Talk a little bit about more of the services that Hearts Alive Village provides.
So you're right, we do have our horse rescue and sanctuary.
How many horses are there?
Well, we've saved 37 horses and 8 goats since our inception of the horse ranch. 14 of those horses have been adopted already. Wow. So they're available for adoption. You can visit our website and check it out. We also have our cat cafe and adoption center, so people can come in.
I got to ask about the cat cafe. So obviously you bring in a cat in and it goes behind a glass partition, so when you're eating, it's not going to jump up on your plate.
They could.
They could.
They could, yeah.
What if you get cat hair in your food? Are people freak out?
Usually people who come don't mind too much.
Wow.
Yeah.
Oh, okay.
So we do have prepackaged snacks there, coffee, tea, soda, water. You can grab food and bring it in. Outside food and beverage is welcome.
Is it popular?
It's very popular, and we're open 7 days a week.
That's amazing. Okay, keep going.
Yeah. So it's a way to, we do ask for a $15 donation per person. Your support helps us to rescue cats. It covers the cost of vaccines, microchips, spay and neuter, and other medical care for the cats on site. At any given time, we usually have between 45 and 50 cats at that location. And most of those cats are available for adoption. So it's a great way to hang out with cats and see them in a home-like environment.
What about food and the potential to get free cat or dog food or animal food?
Yeah, we do have a human support service department that features veteran-specific assistance as well. So those veterans who are in need of assistance can reach out to us. But also the general public can access pet food and a supplies bank. We ask that they reach out through our helpline via call or text. So they can access our helpline at 702-496-0705 or email us at helpline@heartsalivevillage.org.
Russ from North Las Vegas, welcome to the program.
Hello, thank you for taking my call. And first of all, I just wanted to thank this rescue for taking in a cat I brought in, a few weeks ago. And one of the issues that I have is that so many people within my neighborhood have either abandoned their cats, and I've been trying to feed them. A lot of HOAs don't allow you to do what I'm doing, but I've done it. I'm doing it because it's just kind of, heartbreaking to watch. And I have security cameras, and I can see what's going on outside at night and so forth. But and I'm on a fixed budget. Is there ways that I can try to find ways of being able to continue to feed them? Because I don't think all of them are adoptable because they've been abandoned. They've been out in the streets so long. Is there something that I can do about that?
Are there additional steps you might take to help take care of some of these strays?
Yeah, and the best thing to do, and he may already know about this, is to make sure that the cats are spayed and neutered so that they're not continuing to breed, and that's more mouths to feed, of course. But for any assistance, we do recommend our community reach out to our community helpline via call or text or email.
Okay, Russ, thank you so much for that call. We have an email here from Joanne who says, my dog died a year ago from a brain tumor. I miss him terribly and would get another. But I have a 16-year-old cat, and I'm afraid of traumatizing her with a new dog. Am I right to be concerned?
So the easy answer is yes. Cats are not as amenable to changing their own lifestyles like dogs are. So if your cat doesn't like your new dog, that may be a permanent thing. Now, obviously, it can change, but usually, statistically speaking, that relationship will probably be that way. And whether or not that type of relationship is okay with you, meaning are they fighting all the time, or is your cat just kind of hiding? Do you view it as a quality of life issue if they don't get along? These are things to consider. If there's a way you can gradually introduce your new dog to the cat, then that's great. However, usually it doesn't matter with cats because they're so particular about who they're living with and their current lifestyles, especially with an older cat who's kind of set in their ways.
Yeah, that makes sense. Hey, and Nikki, go ahead.
There's also a great solution for this. Maybe consider fostering a dog before making the permanent commitment of adopting. And through our rescue, you can reach out and foster a dog. That way you can gradually introduce that dog to the cat.
And Joanne, go to our website, knpr.org. We will have a link to Hearts Alive Village on our website, knpr.org. And Alice in North Las Vegas wrote in and says, my vet wants my cat to get a dental every year. She's 10 now, had some teeth removed when she was younger. Should I do it every year? I'm nervous about anesthesia.
I love this question because it's so common, and dental disease in animals is incredibly common as well. And we do know with research that infection in the mouth can spread to other parts of the body, just like in people. Not to mention, of course, quality of life issues. If your mouth hurts, you have fractured teeth, tartar, etc., that causes a problem with pets being able to chew their food adequately. So I definitely recommend dental cleanings. It's always under anesthesia. If there's ever a facility that claims they will do it without anesthesia, it's going to be subpar work. It's full anesthesia. Now, the big thing is age-related. I personally don't consider age a disease. It's the normal process of life. And lots of pets are older. They get major operations that do well. Some, unfortunately, do not. As long as your veterinarian can perform a physical examination, confirm that heart and lungs sound good, blood work looks good, the rest is going to be, chances are your cat is going to be fine with this anesthesia. Dental procedures are also relatively quick procedures. They're done all the time. And it's the benefits, at least in my opinion, definitely outweigh the risks. Are there risks? Absolutely. Anytime you do anesthesia, there's a risk. You could have a risk with a 6-month-old dog or cat being spayed with anesthesia if things just don't go the way we want because the body's reacting to anesthesia in a certain way. So I think that as long as you clear out the preliminaries, it's worth doing.
You know, people have always loved their pets, dogs and cats, but it's more so these days. Like I said earlier, they become like family. What's the average lifespan of a dog and a cat? Because I hear people saying, boy, I really want to get another dog, but I just don't know if I can go through the pain again when that dog dies before I do.
We voluntarily get pets knowing that they're probably going to pass before we do as people, right? So we accept that eventual heartache regardless because we love them so much as companion animals. Cats tend to go in the teens as far as longevity. I've had cats go beyond 20 years of age, and it seems like it's getting longer over time as medicine gets better for pets, as well as people are willing to spend more money for their pets to take care of them, so they're living longer. Dogs vary widely depending on breed. A large breed dog, like for example, a Great Dane, maybe 6 to 8 years. If you're looking at a small breed dog, they can go to the upper teens. It depends on the breed and their lifestyle.
Wow. And I have a question here from one of our producers who has a large, strong hound dog that requires nails to be clipped on a regular basis, but the dog hates it. Struggles so hard that they're worried they're going to hurt him. When they take him for a clipping, they have to carry him outside because he'll turn into a dead weight when he realizes where they are. He also hates taking pills, so drugging him is not an option. What do you have to do? How do you resolve this?
So a presumably simple question with a complex answer. Number one, behavior modification is a very common issue with pets, everything from aggression and anxiety to things like this. So if there's a way to hook up with a dog trainer to see if there's measures you can take to try behaviorally to correct this fear, that would be fantastic. That's number one. Number two is going to be have a professional cut the nails, like a veterinary facility or maybe even a groomer that's willing to tackle this. They may or may not run into the same problem you are. Animals in a foreign environment, like a vet clinic, for example, may act completely differently, meaning more docile and accepting of this versus when they're in your home where, they might be king of the castle, so to speak. So that's another thought that I had. In regards to medicating, that was my third thought is, well, can you medicate before you go in for a nail clipping at the vet or the groomer or before you do it at home? And if you're saying that pills are a problem, you can figure out if your vet will order for you compounded drugs, so liquid medication might be easier for you to give your dog. And there are even some pharmacies in the US that'll make transdermal medication where you rub it on the fur, and that may help your dog as well. Now, obviously, the absorption times for transdermal is going to be variable than an oral pill or liquid, but at least those are some options for you.
Is the pill option like Benadryl? Do you put in a piece of, like for a dog, maybe put it in a hamburger or something?
Yeah, Benadryl is a very common one. We use that in VetTriage actually all the time. You can just cover it in like meat, like turkey meat, deli meat, whatever, or cream cheese or American cheese. That helps. But if you want a more potent, consistently working sedative, you're going to need a prescription from the veterinarian. Drugs like trazodone and gabapentin are very commonly used for this, acepromazine. Also, by the way, how are you cutting the nails? Are you using like one of those nail filing drills, or are you using clippers? Because some nail clippers, because some animals don't like the sounds of devices or the sounds of the nail clipping either. Maybe just changing the device you're using can help.
All right, really interesting. Yeah, one of our producers also has a 5-year-old dog who is in desperate need of behavioral training, jumps on everybody, ignores basic commands. Is it too late to put that dog in puppy school?
Absolutely not. We have pets to be companion animals. They need to live a life where the relationship is mutually beneficial, right? And so a dog with behavior issues can be a huge burden to whether or not you even want to keep that dog around, or whether you want to have guests over, or go for a car ride, or walk outside, or the dog park. So there's two methods with trying to modify behavior. One we already mentioned is dog training, things like that. which is what you're alluding to. The second is pharmacological, things like Prozac, for example. When training doesn't work as well, then medical therapy is also an option too. But I do think you should, before you consider relinquishing that dog, try to exhaust all of your options for behavior modification. And a dog of that age can live for a very long time and can have a really nice life with you.
Wow, that's awesome. Rats as pets. And we got an email about that. Doug in Las Vegas says, can you talk about keeping rats as pets? I have 3 rats. And they have this really bad stigma, but they're amazing. But finding veterinarian care is hard.
I
Shadi?
agree. Yeah, I agree. From the pet owners that I know of that have rats, they absolutely adore their rats. Some have one, some have numerous, and they make great pets. Apparently, I have no objection to it. Finding veterinary care for your less conventional animal types is a problem, which is one of the reasons why I started VetTriage, because you can talk to a veterinarian who's familiar with rats on that platform, and if they aren't, we have a panel of 80 vets who can take care of your rat from home virtually. So finding veterinarians for uncommon species is a problem.
But do people get rats at a store, or are these like rats that they found, on the roof and they domesticated it?
Most often I hear people who actually actively try to find the pet from a pet store. However, I've had some where they feel bad feeding like their snake the rat, and so they'll just keep the rat as a pet. So it just depends. I'm not sure if people find feral rats, quote unquote, as pets necessarily, but those are the most common routes I hear.
Yeah, well, really interesting. Doug, thank you thank you for that question. If you want to call in and add some more information, please do. Sylvie from Las Vegas has a cat question. Welcome, Sylvie.
Hi.
Hey, go ahead.
I have a 3-year-old cat. She's a Tonkinese, which is a Siamese-Burmese mix. I got her as a 3-year-old. She'd had 2 litters before she was spayed. She was not socialized well as a kitten. I wondered if there's anything I could do to break through that shyness. When anyone comes, she's gone, and nobody ever sees her.
That is a good question. So it's not too late, although their temperament has a lot to do with it, the individual cat, but there are some things that you can do to have your cat warm up to people. You want to make it a positive experience for them. So if she has something that's her favorite, I've had foster cats or cats that come through our rescue that like being brushed. Some like they have a favorite wet food or a favorite treat or a favorite toy. And you can use that with visitors. Have the visitors play with their favorite toy with them or give them their favorite treat. So they'll start to associate happy things being around people that they're not familiar with.
Yeah, and Shadi.
Yeah, a lot of the behavior modification we were talking about earlier in the show pertaining to dogs can pertain to cats. Cats are, of course, much more difficult to train than dogs are, but we do have board-certified veterinary behaviorists in the U.S. that, although hard to find, it might be a bit of a financial commitment. They're worth it, and they may be able to help with feline training, or again, either or that or pharmaceutical intervention to help with behavior issues. But let's not rule out that some cats can be trained, especially if you're willing to invest the money and time into it.
Can all cats be trained? And the reason I bring this up is because just a couple of days ago, I heard a couple cat owners talking about the expense of kitty litter. And I've seen videos online, I don't know if this is real or if it's AI, of cats, doing their business in a human toilet. Even one of them reaching up and flushing it. Is that first of all, is that real? And can you actually train a cat to do that?
I've seen those same posts online before artificial intelligence was popularized the way it is now. So yeah, some cats are trainable that way. I would say most cats are probably not as easily to train things, especially things as complex as flushing a toilet. But I have seen those posts before artificial intelligence became a thing.
Have you ever seen it, Nikki?
I've seen it online. I've never seen it in person, though.
Okay.
Yeah.
That'd be great. It'd be like the perfect cat. And I do have some questions here. Joshua from Vegas writes, my dog and I take walks in our complex and almost always run into other dogs. But after about 10 or 15 seconds, my dog does this thing where he quickly whips around and hits the other dog's face with his butt. What's that about, and how can I get him to stop?
I don't know what that's about. My thought on that would be, if it's not causing harm to either one of those dogs, perhaps it's just a quirky behavior. I'm not sure I've actually heard of that specific detail prior.
Yeah.
That's new to me.
Okay. Thank you so much, Joshua, for that question.
It may be a submissive move. It may be something where your dog's trying to show, hey, I'm your friend, I'm not a threat, because turning your back to a potential predator is risky move. So maybe it's an act of submission, if I had to guess.
Yeah, potentially. Chuck in Vegas writes, my 100-pound brachycephalic pit bull really needs daily exercise for his heart and knee health, as well as his mood. But as soon as the temperature goes over 80 degrees, it's too hot for him to walk outside. He really struggles to breathe. He's also a little unpredictable with other dogs, not aggressive, just overly friendly. What are some exercise options for him during the hotter months?
So brachycephalic airway syndrome is a condition I talk about as a surgeon on a national scale because it's such a common problem. If your dog is a brachycephalic, so the squished in face dogs like pugs and bulldogs, pit bulls are included as well, spaniels, then you want to get evaluated by a veterinarian to see which one of the numerous possible syndromes your dog has for this condition and see which ones are repairable versus irreparable. I have on my YouTube channel a video that I talk about this in particular because it's such a common problem. If you have situations with conditions with the syndrome in your dog that are repairable as per your veterinarian or veterinary surgeon, then whether or not it's worth the cardiac risk for your dog to go under anesthesia and repair those things is a discussion you have to have. But that's the most permanent way you can try and fix this. Otherwise, it's environmental modification. Only go outside when it's not as hot or not as humid. Keep the environment in the house cool. Definitely keep the weight off because obesity and overweight dogs are going to need to breathe harder to move, and that's inherently what this issue is, the breathing problem. So all of those things are methods to tackle this.
Okay. And we have an email here from Noah who says, my friend adopted a cat that wasn't treated very well when it was growing up. He's now about 9 or 10 years old and does not do well with other cats. But her spouse has another cat who is extremely friendly and doesn't know how to defend himself when the first cat tries to attack him. They keep themselves separated, but they want to try and get them to coexist in the same rooms. Do you have any suggestions? And Nikki, this goes to something you were talking about earlier, which is the personality of cats. I mean, they really, some people think they don't have that, but they really, really do. But talk a little bit about this.
Yeah, absolutely. They have their own individual temperament and personality. And so I can't guarantee that it'll work, but a slow and proper introduction is really important. We talk about that with adoptions for people that are adopting a new cat or kitten and then bringing them to their home environment, having that slow and proper introduction rather than putting them in the same environment and having them work it out. That obviously I'm not an animal behaviorist, and that's someone that they could actually reach out to for assistance. But having that proper introduction is very important.
Yeah, I know somebody who had a dog and they got a cat and they separated him with a door.
Mm-hmm.
The cat would stick its paw underneath the door and slap it around, and the dog would be there looking at it, and that's slowly how they got them acclimated to each other.
Yeah, keeping them on opposite sides of the door, and then like we talked about earlier, having that positive interaction with the other pet, so making it a positive experience. So feeding them their favorite wet food on opposite sides of the door, or having a toy that they play with under the door, and then slowly cracking the door so they can have right. Face-to-face interaction. But it has to be a slow, proper introduction.
And Shadi?
Yeah, I agree with all of that. I think that's absolutely fantastic. And you run the same risk with cats where, you can try your best and it may or may not work out, but that's definitely a fantastic way of gradually introducing. I wanted to circle back to the previous bulldog question also because you'd asked about the over-friendliness of his dog as well. And a lot of pet owners acquire brachycephalics because they are so friendly. They're really, really friendly. Their personality is great despite the fact they have breathing issues and joint problems and heart disease. We love that about them. So I'm not really sure it's pathology per se if your dog is overtly friendly, but again, the same behavior modifications we were talking about through the show may apply there if it truly is a problem.
Okay. I want to get into canine influenza. There's an animal shelter that was forced here to close due to the strain of canine flu that's been spreading pretty quickly across the valley. What do we need to know to keep our furry friends safe from this?
So just like any other flu, whether you're talking about canine flu or with people, it mutates quickly, and with mutations, it can become more and more infectious and pathogenic, virulent. So you want to make sure your dog is vaccinated, right, against influenza and other viral diseases. Your vet can talk to you about that for your particular scenario. You want to limit contact with other dogs, either completely or ideally limit your interaction with other dogs that you know are vaccinated. So dog parks, for example, hiking are potentially a reservoir for this, but also recognize that viruses can travel a long distance by air, and so really preventive measures like vaccines are the way to go. Finally, I would say if your dog is showing any signs of respiratory distress, whether it be something as simple as coughing or sneezing all the way to actual breathing issues, get checked out by the veterinarian. And if you can give the veterinarian permission to run tests to find out this is a viral induced disease, that's identification and treatment is a great way of figuring this problem out.
Well, as with humans, if you get the flu and it's already in you, is there anything you can do about it, though, once it's in the dog?
In a research setting, there's lots of antivirals, but in reality, and clinically speaking, it's all symptomatic treatment. So you treat things like the runny nose, the lung congestion, the coughing, the fever, and you let the body run its course while you support it.
What about the shots? Are they expensive, the vaccines?
It depends on where you go. There's plenty of vaccine operations that are free for the community, and there are some that are run through shelters and rescues that are discounted. Otherwise, your veterinary clinic can do it, and even the pricing between veterinary clinics in a given area, the prices will vary widely. So shop around and see what you can afford and go from there.
I know a lot of people right now who are impacted by pollen. It's going to become a real issue because we had so much rain. Are dogs and cats impacted by pollen? Do they get allergies?
So allergies come in two different categories for dogs and cats, but dogs are far more common, of course. One is either dietary and one is environmental. And you could have both as a problem. The dietary allergies are related to proteins they've been exposed to for most of their life, so not a new protein, a chronic protein exposure, which is why we usually change the diet to a different protein, a novel protein diet. And then in regards to environmental, that's tough because unless you're going to go the route of dermatologist, a consultation and actually allergy testing them, which can be cumbersome and expensive and a long wait time because dermatologists are in need, you end up guessing that there's something in the environment that's causing a problem. And so what do I need to do? Limit exposure to the environment, which is not always a realistic endeavor. So when you meet a dermatologist and they do the allergy testing for your dog, they'll create a vaccine against those environmental allergens to give your dog immunity against those allergens to try and fight this allergic problem you have.
And there was this report that just came out. There was a research paper that came out of California, and there have been news stories now that there's a flatworm that has never been found this far west before. It has been in Texas and in the southeast, but it's now in the Colorado River, and reports say this flatworm can kill dogs. Shadi, what do you know about this?
So the parasite it's a liver fluke. It's a flatworm. It's called Heterobilharzia americana, and it's passed by snails. We've seen it before in Texas, Oklahoma, Kansas. Now we're seeing a spread of it, and so the snails rather, are the primary organism that spreads this, and then from the snails, the parasite will then go to mammals. So usually dogs or raccoons are the next host. From there, it'll infiltrate the intestines, usually through its vasculature, the veins, or through the liver, or both. And part of the problem is the worm itself causes issues like vomiting, diarrhea, lethargy, not eating. But the other problem is when it lays its eggs in the organs, so spleen, liver, small intestines, that causes a granulomatous reaction, which means scar tissue formation, inflammation in the body. Granulomas like that are very difficult to treat because they cause destruction of the organ and because of the chronicity of it. So the intense immune response just from the eggs alone are going to cause a problem. And then, of course, finally, your dog can shed the disease and spread it to other animals as well.
So if you see symptoms of this, go to the vet and they'll kill the flatworm with some medicine?
The issue with diseases like this, when you have outbreaks, is that the clinical signs of symptoms are so nonspecific because anything in the world can cause vomiting and diarrhea, lethargy in your dog. And there are things that are way more common than liver flukes that'll cause vomiting, diarrhea, and lethargy in your dog. So when you go to the vet, they're not just going to look for the parasite because it's a hot topic, but they're going to rule out other causes of vomiting, diarrhea, and lethargy in your animal.
And there's also a worry about killing the worm too quickly. Talk about that, which is really interesting, but strange.
So the studies for this worm, they usually use a combination of two different antiparasitic drugs to treat it. However, sometimes you get a strong antigenic response, a strong immune response, just from the sheer fact that the body has to break down and digest and eliminate the dead organisms. And that immune response could be as bad or even worse than the actual infection. So usually veterinarians, depending on the parasitic load and the condition of your pet, it varies case per case. You want to treat these animals gradually over time so the body has enough time to react to the dead organisms, and you won't see such an intense immune reaction to them.
I got this email from Chloe in Southwest Vegas who says, my dog is a white Chihuahua mix with constant tear stains. I've tried solutions, wipes, chewable supplements, nothing works. His hair is too short to cut. What can I do?
So there's lots of over-the-counter products that people claim work. If you just do a YouTube search, you'll get a whole bunch of suggestions from people that are well-intentioned, that things you can try for your pet to eliminate those tears. Those tears come usually because the dog's anatomic nasolacrimal ducts, so the duct that goes from the eye to the nose where tears usually drain, there's a problem there. And so you end up getting an overflow of tears. The tears then go on the skin. The bacteria that normally live in the skin have a party, and then you have this staining and sometimes infection of that area. So it's not just a cosmetic problem, it's an actual medical issue, but it's underdiagnosed because we tend to just consider it normal for some dogs in their appearance. So try looking up over-the-counter stuff, and then probably a veterinarian, maybe a veterinary ophthalmologist is the way to go to see, is your nasolacrimal ducts abnormal in this dog, and is it repairable?
Okay, and we are taking calls again. And Cassandra from Las Vegas, welcome to the program.
Good morning. Thank you for taking my call.
Of course.
I had a question. I have a 3-year-old Yorkie that just will not eat any animal food except for snacks. I'm really concerned about it. And I was wondering if there's a way to turn that around or if there's any vitamins that I could give him, because I'm really concerned about his well-being.
Sure.
So tough love is my number one response for this. Whatever food you want to feed your dog, that's what they get every day. By day 3, day 4, day 5, this sounds cruel, they'll be hungry enough they're going to eat it. That's number one. Number two, multivitamins. Absolutely. There are lots of canine multivitamins. Now, which ones are actually authentic, which ones aren't? You probably want to go based on online reviews. Unfortunately, I don't have a better response than that. We don't tend to research vitamins because people can just start a vitamin company and start selling it. So just like in human medicine, it's no different there. So you can find multivitamins to try and supplement, but the more you give into your dog's desire for treats and human food, the less likely you're going to be successful with this endeavor.
Cassandra, thank you so much for that call. And Leslie from Las Vegas has a question as well. Leslie, welcome.
Oh, hi. I'm sorry. I didn't know I was going to say it again.
Yeah, that's okay.
I'm so sorry. I have a Cavachon, and since we've had him, I don't know what the deal is with him, but he eats his poop, and I don't know if that is normal or if there's any way we can stop it.
And hold on, before you go on with that, in the same vein, there's another question related. Somebody else wrote in saying, we have a dog whose poop has started turning yellow. Is that something we need to be concerned about? So first, Leslie's question.
So the fecal ingestion is a common issue with dogs. It's crazy to me that they do this, of course, because feces is disgusting, but they will do it. And
so, is there some evolutionary reason?
You know, I don't know offhand what the reason would be. You can argue maybe it's protecting their territory from predators that could sniff them out if they live there. But regardless of that, with domesticated animals, it's obviously not a concern. But I'm not sure if there's any reason beyond that, evolutionarily speaking. There are things you can add to their food. There are things you can add to the poop to try and make the poop less appetizing to them. Otherwise, behavior modification like we spoke about, or just try and remove that feces before your dog can get to it. You can also, if you really need to, one of those muzzles for dogs where every time you go for a walk, you put a muzzle on him, he pees, he poops, back in the house, take the muzzle off when you're in the home, remove the feces from the yard. So there's different things like that you can do. None of it's easy. Otherwise, it's an online search to find out what simple measures people have used that have worked. And it's hit or miss whether these things work anyway. So usually environmental and behavior modification is the way to go. The feces turning yellow actually can be normal. So the brown color from feces comes from normal gastrointestinal tract. It goes from yellow to brown in the body because of different bacteria that act on the feces as the feces moves down the chain of intestines. So yellow may just mean that there's either a bacterial imbalance, which you may or may not need to address. I would use probiotics for that to see. or maybe just that transit time for the gastrointestinal tract for your dog is just too quick, that it just stays the yellow color and doesn't become brown. So it may or may not be pathology, but if you want to try something, try probiotics for a few months and see how that works for you.
Yeah, so interesting. Thank you for those calls and those emails. One of our producers here wants to adopt a cat, but they've heard cats do better in pairs. How are they as solitary animals? Nikki.
Again, it does depend on the individual personality of the cat. However, we do recommend, we don't require, but we do recommend that cats, or kittens, excuse me, get adopted into pairs or into a home with another feline companion. Kittens can get very lonely when they're by themselves, and then they can do naughty things. So we do recommend kittens get adopted into pairs. When people are if they're on the fence about it, I always recommend fostering a cat or two cats at the same time to see how they do. It's a great solution without making the permanent commitment of adopting.
Okay. And we have time for one more call. Mike from Las Vegas, welcome to the program.
Hey, thanks for having me on. A response to the caller who had the super picky dog, that they couldn't find a dog food that they would eat. I had the same problem. My dog would rejected dozens of different foods, and finally found Bill Jack brand Picky No More, and he just loved it.
Oh, the
and
product's
I hadn't seen him respond like that.
Picky No More. All right, Mike, thank you so much for that, and the person who called in, maybe you'll check it out. I do have one more question. I don't know if we have enough time for this, but the question is from Anonymous, who says she only feeds her dog raw food. Is that a good thing? You have about 20 seconds.
Yes, the dogs that I see on raw food diet have excellent body condition scores. Their hair coat looks great. So it seems the ones that I'm seeing anyway, maybe a biased population, respond very well to raw diets. However, it is expensive and a lot of maintenance, so make sure your lifestyle is conducive to that.
All right. I really want to thank Shadi Ireifej. He's the Chief Medical Officer. He's a veterinarian of his own business, VetTriage.com. Nikki Martinez is the Feline Solutions Director for Hearts Alive Village, which is a nonprofit animal rescue organization that is also no-kill in Las Vegas. And if you want to learn more about it, go to our website, knpr.org. And to all the listeners who called and wrote in, thank you so much. They were great questions, great comments.